Okay.
We good?
God, I hope so. Yes.
All right. All right, it's a branching spine and hip exam. Okay, so I'm going to have you turn around for me. You're going to inspect the shoulders for height, and looking at looking for inequality, looking at the scapula for asymmetry, and looking at pelvic tilt. We're going to palpate it. We're looking for pelvic tilt. And looking at the side here, looking for any abnormal curvatures. And I'm going to palpate paraspinous process, or the muscles. And the spine. Okay. The side joints. Greater trochanters. Okay, I'm going to have you stick a foot up on here for me. Ischial tuberosity. Now the other one. Okay, good. All right, now what I'm going to have you do is I'm going to have you reach down and touch your toes, or close to touch your toes. I'm looking for any scoliosis, reverse lumbar lordosis, and I'm going to have you stand up for me again, looking for once fluid motion. What's the word?
Recovery.
Recovery.
You look for scoliosis from the back and lumbar lordosis from the side.
I did.
Okay, I'm just saying.
Oh, okay.
Your physical case.
Are you going to extend on back?
Extension.
Yep. Good. And then try to touch your knees on each side. Okay. On the other side. Good. I'm going to grab your hips and just try to rotate. All right. Good. I'm going to have you walk over to the end of the hall, normal, and then come back on your heels or on your toes part way, and then the rest of the way on your heels. Good. Cool. Now you can go and have a seat. And this point we're going to measure from the middle of the patella. Measure 5 inches up, around. Measure that. Same over here. You're going to compare the sides. 5 inches down. Do that. Now, I'm going to push you on here. Try to lift up against my hands just one at a time. This one. Pull down. Okay. And push out. In. Good. Out. In. Okay. And up. Down. And push your toe down. Try to lift your toe up. Good. Cool. And now, I'm going to have you close your eyes. Just tell me. I'm going to touch this down to your feet here. Does this feel the same as this?
Yes.
How about this and this?
Yes.
This and this?
Yes.
All right, good. And, oh, DCRs. Got my hammer. Here it is. Okay, good. And special test, I'm going to have you lay back down for me. Good. Passive range of motion of the hip. I'm going to have you scoot over to this side of the bed first. Okay, we're going to do extension and flexion. And, oh, no, one more. Good. We'll do that bilaterally. And now the Faber test. Flexion, abduction with external rotation. Good. And straight leg raises.
Sitting.
Sit up on the edge of the table. And like this. I'm going to go straight up in the air. Okay, you can go and lay back down. Any pain with that?
Nope.
Okay. This one? Any pain with that?
No.
Passive dorsiflexion.
Good. And what's next?
Cross right leg.
All right, so we have pain on this side. Any pain?
No.
Okay. And then that one? No. Okay, good.
Reverse.
And now go and lay back on your stomach, or flip around onto your stomach. Reverse straight leg raise. Okay. And back around. The Hoover test. Testing for malingering. Pick up here. All right, I'm going to have you lift up this foot in the air. Good. And then now this one. Good. All right, and that's it.